is fine.
Okay.
So, if your actions inspire others to dream more, learn more, do more, and become more, you are a leader. It's a beautiful quote quoted by John Quincy Adams. So, with this quote, I would like to begin our talk show named Conversation with Consultants. Good afternoon, everyone. I am Aditi Jain, Strategic Clients Advisor of SK Associates and Group, and your host for today's talk show. Before we begin our talk show, let me briefly introduce SK Associates and Group. We are an ISO certified management consulting firm registered under the MSMED Act 2006 with the Government of India. Our mission is to provide consulting services to student entrepreneurs globally, covering areas such as compliance, operations, marketing, research and development, human capital strategy, and operations. Our passion lies in helping these budding entrepreneurs bring their dreams to life and contribute to global economic growth. Now, before we begin our show, let's take a moment to introduce our guest for today. It gives us immense pleasure to welcome Professor Dr. Mehfisha Anjum, Assistant Professor IGNOU, to this special event. We are truly honored by your presence today and we are thrilled to have you share this momentous occasion with us. So, welcome, Dr. Mehfisha.
Thank you so much.
Okay, so the first question for you is, so can you walk us through your journey of becoming a psychologist, certified hypnotherapist, and meditation trainer? What inspired you to pursue these fields?
So I'm a certified hypnotherapist, and initially I was a teacher. First of all, I want to tell you, no, so many people do not know about myself that initially I was a teacher, and I have 15 years experience of teaching. So I was definitely a very good teacher, and at that time also I was influencing my students, and parents were very happy with me at that time also. But by the time I realized that when I teach my students, they are growing, but where is my growth? I realized this thing, and then I thought this thought kept recurring in my mind that where do you stand? You are only a teacher. However, you put your efforts, whatever you earn, but you are mere a teacher. I was not a school teacher. I was running my own academy in the name of Professionals Academy, and this brand is still exists. So I was running this academy with my younger sister. So we both were running it, and we created our courses, and they were very good, and we were getting a very good response. But as I told you that by the time I gained experience, at the end I realized that where do I exist? With what is my growth? And also, having said that, I started losing my interest in teaching because it was a very mundane task for me. It became very mundane. Then I started reading online about psychology. I don't know why, but I attracted towards psychological things. I started reading about psychopaths, criminology, online, just like that, without any degree. Then one day, what happened? My own student, she told me that there is a course and you can pursue your masters in psychology. Then what happened? I was already a master in English, but then because of interest, I pursued it and I took admission in psychology. Even at that time, I was not clear that I will become a psychologist. Truly speaking, so this is how I landed in psychological field.
Thank
And
you for sharing this.
yes, after
Hmm.
completion of my degree, I did so many diplomas related to the same field, like hypnotherapy and past life regression. So many people do not know that I am a past life regression therapist also, and I am a meditation trainer. And I have done a psychic diploma also, which comes into the category of metaphysics, like third eye activation and all that. So I've done all these things by the time.
Great, nice to hear this. So, could you share more about your role as a career counselor at NCS Ministry of Labour and Employment and your experience working with them?
See, when I joined NCS, it was around 2019. It started, and they were recruiting the counselors specifically from psychological background. So I took 1 day training. We all took, all the members who were interested, we took 1 day training, and this 1 day training was very wonderful. And we equipped with all the tools and softwares for a career counselor because I have a specialization into mental disorder. So I treat patients with mental disorder. So I opted this also because I wanted to increase my horizons as a psychologist, as a counselor. So I also participated into it as a career counselor, and I took 3 cases from there in NCS, and my experience with them, I can't say very good because by the time uh, in 2020, so we all know it was a lockdown, and NCS portal, it again renewed. So it took 2 to 3 years for NCS also to come back. So now we have a proper portal of NCS, and there we get some, notifications that there is a employment fair and there is some training fair, and you can visit that. So this is how it is working. It has started working, but it is not fully functional as of now. I took 3 cases from there, and they charge very less because it is government portal, so we can't charge very high. I took 3 cases from there. So, but if I talk about the training part from NCS, the training part was wonderful. It is a great opportunity for the people who want to work online, and their requirement is very minimal. Means that I mean to say that eligibility criteria is not very high. So the people who have done their masters, initially they were recruiting the people from other master's degree also, but then they restricted to masters in psychology after some time. So this is how I joined NCS, and still I'm a member there. Whenever there is a requirement, I take the cases. But that is not my main part. My main specialization, my specification is in mental disorders and to treat them.
Thank you for highlighting it. So, as a lecturer of psychology at IGNOU, what are some key topics you cover in your lectures and how do you engage your students in the learning process?
See, as I told you that I was already a master's. So I had my master degree in English. Now I have two masters. One is in English and one is in psychology, clinical psychology basically. So when I was studying in psychology, I got the opportunity and they told me that if you are already a master in English, why don't you join as a professor here? So they provided me, I can say I'm lucky that I didn't go somewhere, but I got the opportunity from in front. So they offered me this opportunity that why don't you go for it? And if you are already a master's in English. So I joined there as a professor for master's in English. And my experience there, I have till now, it's 7 years, it's been 7 years, and my experience is very good because there I taught at least 70 to 80 students in one batch. So when I was giving my lecture was not very theoretical, it was more practical and example based. So students were, you can see it's a theoretical subject. Basically, English is a theoretical subject where you teach drama, prose, poetry, and different genres of poetry and different genres of literacy. in literature, literary devices. So I covered all sorts of subjects there. Like I had 7 to 8 subjects specifically for BA in English, and then they also offered me English honors subject based on American drama, poetry, Indian literature, and UK literature, different literatures I taught there. So when I was teaching them, it was more realistic form. When I was teaching them, I gave them so many examples. I was able to touch the essence of that poetry. I was able to touch the plot of the drama, prose. So students, they got engaged. They used to get engaged in my classes. So many students used to, demand that we want her for our lecture. Like we want Mehfisha ma'am for our lectures. So there, that popularity, I have seen that increase definitely. So I was taking lectures um, besides my career in psychology as a counselor. So I was playing two roles, one as a lecturer at IGNOU and another as a psychologist at my own clinic.
Great, nice to hear this.
Thank you.
So, how do you integrate hypnotherapy, meditation, and counseling in your practice at Helping Mind Counseling Center to address mental health issues such as depression, anxiety, and family counseling?
Yes, sure. So as you said, you rightly said, people come to me with depression, anxiety, and these days I am receiving a lot of cases related to couple counseling, marriage counseling, and when I take these cases, when a couple comes to me, I find that they don't have only interpersonal conflict in their relationship, but they are also suffering with some mental disorder at the same time which they are not aware of. So when I take any counseling, like suppose family counseling or couple counseling or any person suffering from depression or anxiety, I first of all my plan of treatment is a little different. Everybody has their own plan, so my plan is also different. What my way of treatment is, I just check their emotions, their current emotions, their underlying emotions, because any mental disorder which occurs initially it starts with your emotions. First of all, you face or you suffer from some bad emotions, and when your suffering is prolonged, like you are suffering from the same emotion, like emotion of anger, emotion of jealous, emotion of hatred, emotion of guilt. These all emotions, when you face them, when you feel them for a longer period of time, then it converts into a particular mental disorder. So my approach to treat my patient is through check their emotion. I first check their emotions, their underlying emotions, their underlying unsatisfied needs, their underlying desires, unfulfilled desires, and through my case history session, like my first session is to take their case history. When I take case history, then I understand their underlying emotions, which is not basically fulfilled and they are suffering from. When I understand what is their basic thing which they are lacking, which they are demanding, which they themselves do not know. It's very surprising. If you come to me, you don't know what is the major issue, what is your underlying demand. So this is my expertise come when I check their emotions, and on the basis of that, I counsel them. Even in counseling, we have different therapies. Like very famous therapy is cognitive behavior therapy (CBT), and there are different techniques. like Carl Rogers, client's personal therapy, family therapy. Sometimes it's a play therapy. Sometimes it's a drama therapy, role reversal therapy. Even in counseling, we have so many techniques, so many therapies I apply during my counseling session. And the emotions which they are suffering from, or which is a poor emotion, which is a bad emotion, to remove that, I use hypnotherapy. So, would you like me to explain you a little bit about hypnotherapy because so many people do not know about it, how it works?
Sure, definitely. Go ahead, please.
Yes, yes. Because I want to tell about hypnotherapy. See, we generally whole day we think consciously. This is our prefrontal cortex, this part of the brain, and we use whole day conscious thinking. So when we see the structure of the mind, we have basically two parts of the mind. Brain is a hardware, and the mind, the function of the function of the brain is mind. That is software. So we all psychologists or whoever working into it, we say that brain is a hardware and mind is the software of this hardware, right? So I'm talking about mind basically. So mind has two parts. One is conscious mind and one is subconscious mind. Generally, when we are awake, we are in a waking state. We use our conscious mind. We use our subconscious mind at the back, like our decision making, our intuitions, our feelings, they are based on subconscious mind. But when your subconscious mind is activated, when you are in a sleepy state, or when you are drunk, or when you are a little sleepy and you are in a relaxed state of mind, then your subconscious mind surface up. That means it becomes activate, it becomes active, and your conscious mind becomes passive. What we do in hypnotherapy, whole day you are thinking, thinking, overthinking, taking anxiety. That is the part of your conscious mind. During hypnotherapy, we slow down your conscious mind, which is full of anxiety, stress, and we activate your subconscious mind. When subconscious mind comes up, it shows your fears, underlying, as I told you, your underlying emotions which you do not know consciously. So it surfaces up, it shows what is your fear, what is your underlying emotion, unfulfilled desires, whatever which is not required. During hypnotherapy session, we just take it out and remove out of your subconscious mind. Because we just slow down conscious mind and now we are working only on your subconscious mind and we put those required things which is necessary for your treatment like positive emotions, motivation, confidence. If you have self-esteem, poor self-esteem issue, poor self-confidence, we put inside it those required emotions in your subconscious mind. When you come back out of this therapy, you don't feel anything. You are okay and you are relaxed. But day by day, you will see that now you're more positive, now you're more confident somehow, like magic has done on you. So, this is hypnotherapy which I use in the treatment part, and in counseling sessions, also I use techniques of counseling and I treat patients like this.
Very well explained. Thank you for sharing this. So, could you elaborate on the services offered at Helping Mind Counseling Centers, such as past life regression therapy,
Hmm.
age regression therapy, and healing techniques? And how do these services contribute to holistic mental well being?
Yes, sure. So, I'll start with an example. Uh, I also provide internships to psychology students at my center. So students from different universities and specifically from IGNOU. They come to me and they pursue their internship program here, and I provide them certification as well and give them a practical approach of this psychological services, right? Um, so one of my, I will start with an example. One of my interns, and she was suffering from water phobia. Now you understand phobia. Uh, when you have illogical, excessive fear of something that you can't even see it, not even a photograph, and you feel you have uneasy feeling. So she had a water phobia. She could not go near water bodies, water parks, and she had some illogical feeling of sinking and fear of sinking into it. She was doing internship with me, and I had to teach her some therapy. I was giving her relaxation. I was teaching a relaxation therapy to her, and suddenly an idea came to my mind that take her into past life on the spot. Her mind was very relaxed, and as she was my intern, so I took her into, and she was very much fond of past life. She was telling me, "Ma'am, I want to experience it. I want to experience it." So what I did, because her willingness was there, and she was already agreed that I want to experience it. At that time, without informing her, I took her into past life regression. She connected, and then uh, she started having some visuals of her past life. Like she saw her own family sinking into a flood. There was a flood in their village and in her past life, and she saw her parents drowning in the water. The whole village was drowning in the water in front of her eyes. Only few handful people were saved, and that was an incident in her past life, and everybody drowned in front of her. Everything. She was the survival at that time in that past life. And then now I'm talking about healing part. You added healing, and now I want to talk about it, healing part. So she was already into that session. She was involved, and how we do healing uh, during these therapy sessions, like PLR, age regression. Sometimes you are connected with higher guidance. I know logically people don't believe in it, but God exists. We all have some faith into it. And some entities are there, some powers are there, which is contributing for the survival of this universe. When we do healing, we use the higher guidance into healing part. We use the higher guidance, and sometimes our higher angels are there. And during these sessions, sometimes you get connected with them, higher guidance, some power, some entities. So when she was watching all these visuals, at the end of it, she got connected with the light, some super light, higher guidance, and she received the messages for her current life. That now how you have to sustain and how you have to lead your current present life. And it was very surreal experience for her. And when she woke up, when she came out of this therapy, PLR, she was highly happy. And you won't believe now she has no autophobia automatically removed. For phobias, for fears, we take a lot of medicine, psychiatry medicine. But hypnotherapy and these therapies, PLR, they are so powerful therapy that only in one instance, only in one session, you can get rid of your mental disorders. Now she has no water phobia. She went to water park. She enjoyed it, and it is removed. So this is healing. What we call healing, healing is this. When you are connected with superconscious, that is universal mind, when your subconscious mind is activated, you have a tendency, you have a chance to connect with superconscious, with universal mind. And when you are connected with supercomputer, you may call it a supercomputer, right? We are mini computers. That is a supercomputer. When we are connected with superconsciousness, then you know the universal mind is very powerful and it knows everything for everyone. Then you get some messages downloaded, and you get the messages which is very, very useful for your current life and which is very, very useful how to solve your current problem. She received, now she is leading and she is becoming successful. She is leading a very successful life. Like as a student, she is doing so much in her career. She is learning properly. Before that, she was in a confused state of mind. She is very confident and happy at the same time. So healing part is done during the therapy session. This is healing. I hope am I clear to you and I have answered you properly for your last question.
Yes, yes, definitely. And thank you for sharing this example as well. It was nice to hear this.
Thank you.
So, the next question is, what role does dream analysis play in understanding and addressing psychological challenges? So, can you share a specific example of how dream analysis has helped a client?
Yes, yes, definitely. I will give you an example. First of all, I want to explain you about dream analysis. What is dream analysis? It was discovered by our father of psychology, Sigmund Freud. You must have heard about his name. He is known as the Sigmund Freud is known as the father of psychology, and he discovered this. He used hypnosis very well on thousands of people, and he also used psychoanalysis, and these are called psychotherapy. Hypnosis, psychoanalysis, dream analysis, all these are psychotherapy, which was discovered by Sigmund Freud. And he used dream analysis along with hypnosis. What he understood, and he has written a very beautiful book, Introduction to Dream and something like that. This is the topic of his book, and he explained very well about dreams. What is the we see the symbols in our dreams? What is the meaning to that, and how we can understand our own dream. In when you share, when any patient share his or her dream to me, I I listen to it very carefully and I ask them to give me a very, very fine details of your dream, as much as you remember. And then I try to understand their feelings behind it, and I try to understand the symbols of their dreams. Sometimes it will be very surprising to know that we see different illogical symbols in our dreams, right? We see sometimes washrooms, it's very common. We see sometimes we are in an unknown place, we are with unknown people. So these are symbols in the dream. We sometimes we see snakes very frequently. People see snakes, a lot of snakes. Sometimes people report about seeing very dangerous and very big, huge animals. Sometimes these are very common things which I am telling you. Sometimes people see in their dreams that somebody is chasing them. Sometimes people see that they are trying to escape, but their body is very heavy. They are not capable of stepping ahead. They are feeling very weak. So these are very common things. Every these symbols have a particular meaning in dream analysis, and by taking finer details, there is a procedure to dig out what they are feeling behind it, what is their feeling behind it, what is their emotion behind it. There is a proper procedure. There is a it's a certificate course also in dream analysis. So we have to learn it. You cannot decode dream like this only. And we also have to check the time duration of their dream when they were watching this dream. What was the duration of the day and time? Everything matters to decode a dream. And what is happening in their current life, and what kind of problems they are facing, like what kind of diseases they are having, mental disorder in their current life. So I take all finer details, and then with the help of my skills and learned experience, I decode it. I have seen after decoding a dream, a client is very satisfied to understand their own underlying emotions. So currently, one of my clients, I asked them, tell me if you are seeing any dream also these days. She told me yes, she is always seeing that she is running and somebody is chasing her. She is running and running and running and somebody is chasing her. And she has very difficulty to escape out of it. Then I asked her about her current life situation. So she is in a problem due to her family matters, which she is not able to resolve. She feels incapable of resolving this matter because in family she has not that much power to resolve it. She feels suppressed and she is dominated by other member of the family. So when she is running, that means she is actually running in her life out of that problem. She is running out of that problem in her current life. So she is seeing that I'm running in my dream and somebody is after me. Somebody is chasing me. Somebody is trying to hold me. What is happening in her current life is she is dominated by any other person in the family. So that means she is running out of control. She because in her current life she is controlled by someone else. So in her dream, she is watching that she is chasing, she is running, and somebody is trying to control her. And this is the same situation in her life. So it is coming in the form of symbol that she is running and somebody is chasing her, and she is running out of her control. That is her inner feeling, inner emotion that she wants to come out of that control, but she is incapable of taking any decision to come out of this situation. So now, how would I help her? I First of all, I will understand. I decoded her dream and I told her, actually, you feel like this. She admitted, yes, this is my all time feeling that I want to come out of that control. I don't want to live my life in control. I want some freedom in my life. So she is running for freedom. And the person who is chasing is the control in her life. I ensured her that now you start speaking about your feelings to the family member out of whom you are so much scared. So you just tell that person and start sharing your inner feeling and what you feel. Don't get scared, take an action. For that, I give her a therapy session so that she gains some confidence to speak out. Here, hypnotherapy helps you to gain the confidence so that in your real life, you get some confidence, you get some motivation to express your feelings and emotions to the people. Because If you will not speak about your inner feelings, people will control you. As long as you keep it inside you, you will not get any result. So by that hypnotherapy session, she gained some confidence and motivation to speak out. So when she started speaking out about her inner feelings to that person in the family, that this is how I feel, because sometimes people control you because they feel that you are okay with it. That's why they control you. If you show them, no, I'm not comfortable with it, please don't do this in a polite way, in any way. If you tell them, no, this is not done, you are not speaking out of fear. That person is controlling you because he or she feels it's okay, it's fine, it's normal thing. You have to tell them it's not normal for me. I'm suffering because of this. So this is how it works. The counseling, the dream analysis, and then hypnotherapy helps you to boost your confidence and motivation. And when you start working on that problem, you get the solution that all that person also understood. Okay, you feel like this. Why did you tell me earlier? I will try to change myself, and then your problem is solved. This is how. So, like this, dream analysis helps you. Also, I want to add one more thing which is very important. So, please allow me to tell this. Uh, Dream analysis also helps you to understand PTSD. PTSD is post traumatic stress disorder. You must have heard about PTSD disorder. Do you? I don't know how many people know actually.
Sure, you can elaborate something on it.
Yes, yes. So post traumatic stress disorder is for me, it's a very severe disorder. It happens to the people who are suffering from some trauma, like they have faced deaths in their family, they have seen large scale deaths in the area, like army people, soldiers. Basically, army people have PTSD, and the area, the sensitive area where people see death in their surroundings, uh, like some attacks, earthquakes, the people, the survival of this, they have PTSD, and even we normal people also face PTSD because if we face any traumatic incident in our life, like rape victims, they have PTSD, and something happens to her, and something in some any bad incident suddenly happens in our family to us, then we have this disorder, PTSD. PTSD, is a very severe disorder where you have recurring dreams, whatever happened with you. Understanding? If you face a death of your near and dear person, the same incident will repeat in your mind, in your dream. That means once you have faced that incident in your real life, it was a trauma. Like in your open eyes, you have seen some loved ones dying in front of you, and now this incident is taking place in your dream every day. Understand what will be the situation of your mind. How would you feel if same incident, if somebody was raped, a girl was raped by someone. Now that girl is facing that rape again and again in her mind, in her dream. Imagine the condition of her mind. Along with it, you have depression in PTSD. Along with it, you have numbness in your limbs, in your hands, in your legs. You have shivering. You have abnormal, excessive anxiety suddenly without any reason. Sometimes you are feverish, and sometimes you become very aggressive, very violent, and you can commit suicide also. PTSD is a hell. All disorders are hell, but PTSD is a very poor condition. of your mind. So, in that case, the same dream occurs in your mind. When my client reports me any dream which is recurring in her mind and it is giving her a shock, because when you are suffering from PTSD, you are sleeping and watching the same incident, and you just wake up with shouting and crying like a hell every now and then. Mostly every night you watch the same incident and you are crying, you are shouting, and you are out of your control. You become violent. So if my client reports me that I have this dream and every night I just wake up with my heart is pumping very hard and I'm shouting, I'm crying, I understand that this person is suffering from PTSD along with other symptoms. So here also, in the case of PTSD, help, in case of PTSD, dream analysis helps me to understand if a person is suffering from PTSD. So dream is the major thing in PTSD. Recurring thoughts, recurring dreams. That's all.
Thank you for sharing this and highlighting certain facts about it. So, the next question is, how do you approach skeptics who may doubt the effectiveness or legitimacy of hypnotherapy as a treatment modality?
So many people come to me and they are very much scared of hypnotherapy. They express their doubt. So what I do, I tell them first of all, I will not perform hypnotherapy on you without your permission. And I give them education about hypnotherapy. I educate them first of all. I tell them about the you know procedure of hypnotherapy, that how it is done and how much you are safe in it. I tell them that while hypnotherapy, you are not in my control. You are in your own control. So many people have this myth that if I hypnotize you, you will come in my control. That is a myth. That's an illusion. It's very wrong information about hypnotherapy. And get it done by a certified hypnotherapist who is using it scientifically. Don't go to any other person who is sitting with some any other profession and just for experiment he is saying or she is saying, oh, I can use hypnotherapy on you, and that person is just using it as a you know to gain experience, to gain knowledge. The person is experimenting on you. Don't go to that people. Don't go to crash people. So first of all, go to those people who are doing it scientifically, who are certified, who are trained, properly trained into it, so that you have less fear. Because if you are coming, if any person come to me, I feel when I explain them, they quickly get confidence, and if they don't, I don't perform it without without your permission, without client's permission. I don't use hypnotherapy. And if they want to experience it and they have little fear of it, what I do is I tell them first you take relaxation therapy. So they are ready for relaxation therapy. It's very normal. And when I give them meditation or relaxation therapy, they enjoy it. And when they come back, I ask them, how do you feel? They tell, yes, it was very relaxing and I'm feeling fresh now. So I tell them, with relaxation therapy, hypnotherapy starts. Similarly, hypnotherapy starts with your relaxed mind. You will be in the same state of mind which you have experienced right now. And then I will use hypnotherapy in the same state of mind. So, were you in your control or not? They answer me, yes, we were in our control, and it's similar, but it will be a prolonged therapy. Relaxation therapy is short term, and its duration is short, and hypnotherapy is a lengthy therapy. So then, when they experience relaxation therapy with me, they gain some confidence. I also tell them about it, and then their fears and their doubts disappear.
Thank
And
you for
still if
sharing
they have
this.
any problem, and still if they have
Hmm.
any problem with it, I don't perform.
Okay. So, what do you believe is the primary reason behind the prevalence of teenage issues among students from the perspective of psychologists?
Okay. Whenever we are talking about teenagers, the first thing come in my mind is parenting. Parenting plays a key role that how your teenager will behave. Also, so many other factors are included into it. When you come to your teenage, you face so many challenges. One is biological, hormonal changes. Abruptly, your growth is there, and your physical body is also changing. It is transforming. You are in the state of metamorphosis. Number two, your parents behave differently with you. Suddenly you feel my parents are behaving differently with me. Suppose you were 10-year-old and after 2 years, like you are leading to 13 of your age, after just 2 years, your parents are behaving differently with you within 2 year span. So how would you feel? You will feel confused that just 2 years before they were treating me like a child. Now they are behaving as if I am an adult. So they are already in the state of metamorphosis. They are already in the state of changing in biologically and mentally, emotionally, and external thing is also in your environment is also changing because parents have another expectation to a teenager that you become responsible. Suddenly, you become responsible. You take care of your own thing. 2 years ago, that responsibilities were burdened up by your parents. Now, your parents are very strict suddenly with you. Number three is schooling, academic pressure. This is one more contributing factor, academic pressure that you have. Now you have to perform well. Now syllabus is suddenly lengthy. The expectations of your teachers is also increasing. Okay. Number four is peer pressure. Now what your own age group is feeling. They are complaining about their parents and they have a common problem with their parents. Oh, my mama also always telling me about do this, don't do this, do this, and you have common problems among teenagers. They have common problems like from their teachers. Now teachers are putting a lot of pressure, academic pressure. So that's why teenager issues occur. One more thing I want to add into it is that when you are changing biologically, your physical appearance is changing. You have so many other internal conflicts. You are become very careful about your skin, about your look, about your body shape. If you are becoming beautiful, then you are happy also. If suddenly you are becoming darker, you have another inferiority complex with other girls or boys. If you are growing your hair, suddenly another your friends are not having that much. You are becoming hairy, and your own friends are not that much hairy. You have another complex that what I am becoming day by day physically. So there develops the inferiority complex, complex of skin. Oh, I'm not as much tall as he or she. Oh, I'm not as much fair as he or she. Now my all friends are taller than me. That's another issue. Why I'm not so much tall? She looks prettier than me. So these personal conflicts also occur in a teenage, which is a very common issue which comes to me. Poor self-confidence also. Like some uh, children are very friendly. They create their group. On the other hand, you are shy, you are introvert. So when you are becoming a teenage, you see that groups are being created, but you are not able to become a part of that group because you have shy nature. Because your confidence is low. You feel you want to get approval of others. You are not very self-confident. There, I think this role is played by it should be played by their parents to build some confidence, to inculcate some confidence in their kids so that they cope up with all these inner conflicts, personal conflicts. So that's why these teenage is a very I feel that teenage is a very roller coaster ride where you have lot of pressures as I explained you one by one. And at the same time you're going through all these conflicts. So you can understand that how teenagers are burdened up with all these conflicts and why they face these issues. And I have also seen teenagers with OCD, obsessive compulsive disorder, with poor self-confidence, body dysmorphic disorder. Then you have a complex with your body shape, with your height, with your complexion. So you always find faults in your face, in your body. Oh, this is not appropriate, and because of that, you are not able to uh, score good marks. You are not able to do good in academics. You are not able to be a part of society. You are very introvert. You want to hide yourself, and you develop a lot of complex in your mind, and you are not leading a good and healthy teenage life. So this type of issues comes to me in teenagers.
Thank you for sharing this. Very well explained. So, the last question for today is, what advice would you give to someone interested in exploring hypnotherapy, either as a client or as a practitioner?
First of all, have a complete knowledge about hypnotherapy. If any person would come into hypnotherapy when they believe in it. If you believe, if you have even a little interest, first explore it, understand it, and educate yourself, and talk about it to the experts. Like my interns come to me and they know that I am a hypnotherapist as well. So they talk about it. They ask me, "Okay, what you do in hypnotherapy as a psychology intern?" They must know what is hypnotherapy, what modality it is, because in the syllabus of University of Psychology, hypnotherapy is not included. Hypnotherapy is another branch as of now. In the syllabus of psychology, hypnotherapy is not included. So if you are interested into hypnotherapy, you will not find about it in your syllabus. You have to take or seek outside sources to know about it. Like you can talk to experts. You can buy books on hypnotherapy. You can buy books of foreigner hypnotherapists. They are doing very well. I tell you, in India it's not very much prevalent, but in foreign country, hypnotherapists are doing very well. They are very much valued. Whereas in India, people are skeptical about hypnotherapists. Sometimes I feel that when I tell them I'm a hypnotherapist, people are scared of me for a few seconds. So seek proper information about it and then find a proper institution, proper trainer to learn it. And if you are talking about clients, like clients, when I tell them that I need to perform hypnotherapy on you, I want to give you this. So they ask me what is it. I tell them, I educate them. So as a client, also you should be aware. Don't take any therapy without information. If you're a client, you come to me, you have a right to know about it, understand it, and then take a sample therapy for it, first of all, if you want to experience it. So just request your therapist, can you give me for 5 minutes? I want to experience it. And then you can proceed for the full-fledged hypnotherapy. Information is very important. It plays a key role to decide what you want to do, you want to learn it, you want to take it. Information is very important. So don't scare. My advice is don't get scared of it. Take information, get confidence, and then go into it.
Thank you for sharing your thoughts. So, moving ahead, we would like to express our sincere gratitude to Professor Dr. Mehfisha Anjum, Assistant Professor IGNOU, for being our guest for today at Conversation with Consultants. Your presence and engagement helped to make it a success. So, thank you for providing insight into your inspirational journey. Further, we would also like to thank everyone for listening patiently. So, thank you everyone for joining with us today.
I
Looking
also want to thank to all of you, to you, Aditi, and SK Group for inviting me on this platform to so that I can impart my information, my knowledge, my experience with all of you. It is a demand of the day. These type of sessions must be done with experts, and you are doing a very good job. You people are doing a very good job. And this is my second time experience with SK Group, so I deeply give my thanks to all of you for inviting me here on this platform.
Thank you so much. Looking ahead, we are excited to announce that our next episode of Conversation with Consultants will be held next weekend. So, thank you again and look forward to reconnect with you all. Do subscribe to all social media handles and stay connected with us. So, thank you everyone for joining. Thank you once again. It was a great session with you. Thank you.
Thank you so much. I also enjoyed it.